Here is a patient with temporomandibular joint dysfunction, which is one of the most common cause for ear pain or referred otalgia, and sometimes also headache in adults as well as in children. It also sometimes causes neck pain and the pain which is also referred to the shoulder. Commonly, these kind of patients point pain on the lateral part of the neck or just under the submandibular region at almost roughly approximated the level of the hyoid. This is a common thing with which these patients come to. So one should have a suspicion of a temporomandibular joint dysfunction whenever you evaluate these patients. Many of them believe that this is a ear problem and they come to you asking for ear drops or some medicines for treating their ear condition. But most often, sometimes these kind of patients are misdiagnosed and mistreated. Also, I want to add, whenever we do ear surgeries, when you do a mastectomy surgeries, mastotympanoplasty surgeries, canal wall down or canal wall up, and even sometimes in transcanal ear surgeries, because of the dressing that you put post-mastoid surgery, the patients tend to not use their temporomandibular joint properly when they're chewing. Their chewing habits tend to alter, and because of this, the patients go for a temporomandibular joint dysfunction. So here I am going to show you intra-articular injection. We always give them muscle relaxants, odd fomentation, and correct their chewing and take soft diet for a few weeks. Along with that, a single shot of an intra-articular injection can be very useful. This intra-articular injection is given with a mixture of a steroid and then a local anesthetic. Usually I use this 26 gauge 1.5 inch needle. Also, when you are giving this intra-articular injection, sometimes there will be temporary facial paresis. So one should always take a consent there could be temporary facial paresis. I am using my thumb to check for the TMJ area tenderness in the preauricular region. Madama? So you can see the facial expression. She is having a lot of pain in the right side TMJ area. See, I went into the joint space. Okay, you'll get that giveaway when you go to the joint space. You also have some consistent vessels in the preauricular region, some venous drainage which is there, and sometimes you tend to pick and there'll be a bloody tap when you aspirate. Always aspirate. Now gently infiltrate here, gently infiltrate. Be gentle when you're palpating the patient, because patients with TMJ arthralgia come with severe pain and severe morbidity, and some of them almost come crying with pain, and this one gunshot is such a great relief to the patient. See, there's no bleeding, so hardly anything. So bidama, you keep a post intra-articular injection. I always tell the patient to wait for about few minutes, 5 minutes in your clinic setup where you're seeing the patient, to sit, and then before sending the patient, you just check whether they're having pain relief or not. Thank you.